Dear learners, welcome to today's session on healthcare of women. As you all know that women are the backbone of any society. They are the caregivers, the nurturers, the mothers of a family. And in spite of being the backbone, in spite of being the caregivers, women's health is more often neglected among all the other members of the family, among all the other members of the society. So today we will be discussing on a very important topic of healthcare of women, and for this we have with us our expert, Dr. Grace Dawn Nemching. Welcome, Dr. Grace.
Thank you, Nisha.
So without much delay, let us ask Dr. Grace, what is women's health?
Dr. Nisha, when we are talking about women's health, according to Medical Encyclopedia stated that women's health refers to the branch of medicine which focuses on the treatment and diagnosis of diseases and conditions that affect a woman's physical and emotional well-being. Like you said in your introduction, women are the backbone of every society. So the healthcare of women is essentially linked to the development of the family, society, and the nation. When we are talking about healthcare of women, it is very important to discuss why we are going to stress on the importance of women being healthy. Women, as you know, when they become mothers in a family, they always neglect their health with regard to keeping the health of the family members first. It may be the in-laws, it may be the husband, it may be the child or the children. So when we are talking about the condition of women with regard to health, we see that in many societies, it has been neglected and women themselves do not give so much importance to their well-being. And a woman's health is very much linked to her emotional and physical well-being. If you are not emotionally happy, then it will be very difficult for you to do your work, your day-to-day activities, or if you are in a job, it will be very difficult to concentrate on your job. And also, when you are emotionally happy, then the whole family is also happy. A happy mother would lead to a happy environment in the family. And also a woman has to be physically healthy as well, because when we talk about physical well-being, if a woman is sick, if a woman is not well, then one can see that the function of the whole family is disturbed, or the function of the family cannot function very well. So when we are talking about healthcare of women, these are the points that we will be covering, or we need to cover when we talk about healthcare of women.
Thank you, Dr. Grace, for letting us know what is women's health and what are the different things that come under women's health. Now, having discussed that, could you tell us what are the indicators which indicate the health status of a woman?
There are certain indicators to know about the status of women's health. One of the indicators would be maternal mortality ratio, MMR. The maternal mortality ratio, MMR, is defined as the number of maternal deaths during a given time period per 100,000 live births during the same time period. Which means that if you have higher MMR, it shows that there is poor maternal health status of women in the country. When we are talking about MMR, in the South Asian and Sub-Saharan African countries, MMR is higher in these countries. And to know more about the indicator of a woman's health status, then we have another indicator, which is sex ratio. Sex ratio is the number of males per 1,000 females. The low sex ratio also depicts the decline in female population in the society, which may be due to female feticide, infertility among women, and also missing women. So when we are talking about sex ratio in a country like ours, जो हमारे देश है भारत में, the sex ratio is less than the male. So there are certain factors which are attributed to why there is a low sex ratio. It could be because there is female feticide, which means that women would go for abortion during I would like to say that female feticide in our country is very dangerous for a woman's health. Female feticide would be when a woman is pregnant, and when she gives birth to a female child, then the female child may be just killed off, or the female child is abandoned to die because it's a female child. Or it could be because of infertility among women. Infertility would be because of certain conditions, which can be because of your hereditary. It could be because of certain environmental factors, and also the condition of missing women, where women are kidnapped or women are sold off. Women are they disappear. You don't know where they have gone. So these are the factors which leads to low sex ratio. Then we have another indicator of a woman's health, which is anemia. Anemia is a condition wherein the number of red blood cells, or the hemoglobin concentration within them, is lower than normal, which affects the body's ability in carrying oxygen. So when you have women who are anemic, when we have women who are suffering from anemia, then there would be a lot of other conditions related to women being anemic. There would be a feeling of fatigue, there would be a feeling of weakness, dizziness, and a woman will not be able to perform her normal day-to-day activities when a woman is anemic. So these are one of, or I could say few important indicators of a woman's health status.
Thank you, Dr. Grace, for letting us know the different indicators. As you rightly said, maternal mortality rate, then the sex ratio and anemia. These are some of the indicators which tell us about what is the health status of women in our country. Now, having narrated to us what are the different indicators, could you tell us what are the health problems, what are the health issues of women that are prevalent in India?
When we are talking about the various health problems and health issues of women in our country, health issues like heart diseases, where women are prone from hypertension or are prone to heart diseases. Because of this condition, it has become one of the leading causes of death among women, that is heart diseases. Then we have cancer. Women are also suffering from cancer. It poses a serious problem of morbidity among women. Some of the cancers that often affects women are related to breast. It is related to colorectal, that is cancer in the colon. Then you have endometrial, lung cancer, cervical, skin and ovarian cancers. So these are the various types of cancers which affects women. Then we have another type of disease which is also common to women. You have what is called your gynecological problems. Women suffer from various gynecological problems which affects not only their physical and mental health, but also the quality of life. For example, commonly women would suffer from abdominal pain during periods. They would also suffer from endometriosis, where the uterus starts growing outside the walls of the uterus. And also women suffer from what is called UTI, urinary tract infections caused by bacteria. Another problem would be mental and psychological problems. These are conditions like depression, anxiety, feeling of isolation, then also serious mental illness. A lot of time, Dr. Nisha, women, as we know in our society, we do not usually talk about our problems. We tend to hide our problems. Instead of talking about our health problems, we tend to focus more on the health of our parents, our spouses, or our children, our child. So it is very important for women to come out and talk about their health issues, their problems, because when you suppress your problems, then it leads to a lot of anxiety. It can lead to mental illness. It can lead to depression. So it is very important that women come out and talk about problems which may lead to a better better quality of life. And when I talk about better quality of life, it means a life where you are free from stress, a life where you are free from depression, anxiety, and so on and so forth. Other diseases and health conditions which affects women are STIs and HIVs, the sexually transmitted diseases, and HIV. It is noted that in a lot of regions in the world and a lot of countries in the world, women suffer from diseases like sexually transmitted diseases and as well as HIV. And a lot of time what happens is these diseases affects women who are aged between 15 and 49. And when I say 15 and 49, these women who are in this age group are women who are in their reproductive, they are in their reproductive, the most reproductive period. So when you are infected by STIs, when you are infected by HIVs, it lessened your lifespan. So it is very important that women should go for regular checkup. There are medicines to reduce the various effects and symptoms of diseases like HIVs. And when we are talking about the health conditions, the health status of women, it is important to note that if a woman of the family is healthy, then the health of the whole family, if a woman is healthy, the health status of the whole family would also be good, and it will be a wholesome development in terms of mental, emotional, and physical well-being of all members of the family.
Thank you, Dr. Grace, for elaborating upon what are the various diseases, what are the various health issues women face, and especially in India. As you rightly stated, there are cardiovascular diseases, there are different kinds of cancers, and there are different kinds of other sexually transmitted diseases like HIV and AIDS. So, having listed out the various health issues that women in India face, could you tell us about what are the measures that can be taken or that are taken to improve women's health in our country?
The important steps which can be taken to improve the health status of women would be avoid smoking, avoid eating gudkha. In many parts of the country, women would smoke biris, women would, eat gudkha, which is very harmful for the health of the women. especially when a woman is pregnant, when there is a baby in her womb, she should avoid totally, as well as, not even start eating gutka or smoke. Women should go for regular exercise. Exercise is very important for the development of a women's health. For example, if a woman goes for brisk walking, on most days of the week, we can see that a lot of diseases would be under control. So regular exercise is very important. And nowadays we see that a lot of girls is suffering from what is called obesity, and they are overweight and they become very lethargic. So it's very important that women and girls should take regular exercise, maintain a healthy weight. Gaining weight is a common problem among women, especially when you give birth to your child or your children. Gaining weight while you are pregnant or gaining weight after you give birth is very common. And because of this, problems like thyroid may come into being. So it is very important that one should, control your weight so that it lowers your blood pressure. It also reduces the risk of diabetes, which is very, diabetes, having blood pressure, has been found to be quite common among women now. So it is very important that you should maintain a normal weight, wherein you should not be too overweight. So this would lead to reduction in your blood pressure. It would lead to reduction or reduce the risk of diabetes. Another very important factor of how to improve a woman's health status is nutritional care. Like I said, women usually do not concentrate much on her health because she always gives preference to the family members. So it is very important that a woman should also should also focus on her health in terms of having a balanced diet, especially when women are lactating or when a woman is pregnant. It is very important that they should have nutritious food. Then women should know how to manage stress, because if you are too stressful, it can lead to a lot of conditions like heart disease. It could lead to coronary microvascular diseases among women. And stress also leads to a lot of mental problems as well. If you are too stressed out, it leads to anxiety. You become very irritable. You are not able to function properly. And when we are talking about how to improve the status of women's health, what are the measures? Another important factor is female doctors or female practitioners should be available to treat women, especially at the grassroots level. Usually women are shy to consult a male doctor during time of medical complication. And so, especially in rural areas, if female practitioners, if female doctors, female medical practitioners are employed or posted at the primary health center, it will go a long way in promoting the health of women. So Dr. Nisha, these are the steps which have to be taken into consideration when we talk about how to improve a woman's health.
Yeah. Yeah, and rightly, as you were stating, that smoking is one of the
Right.
root causes of ill health. And many a times it just came to my mind that women may not be active smokers, but they may be passive smokers. If any member of the family is smoking, and if they are in that environment, they inhale that smoke and they become those passive smokers, and it becomes hazardous to their health in spite of them not being at fault. And you rightly stated about how lack of nutrition also is a major cause, because women are not careful about their health, and because they do not take enough nutritious food or nutritional supplements, they are also exposed to different kinds of diseases. Thank you for letting us know what are the various health concerns that women face. And you also rightly pointed about how how important it is to have female medical practitioners, because still in most part of our country, mostly in the rural part of our country, women are still hesitant to go to a male health giver, and they prefer female health givers, healthcare providers, and female doctors whom they can approach. So very rightly you have mentioned all the important key points. And having discussed that, could you briefly tell us about what are the healthcare programs of the Government of India that the Government of India has initiated to take care of women's health?
The Government of India have taken certain measures or have introduced certain healthcare programs to improve the condition of women. We have the National Rural Health Mission, NRHM, which was launched in 2005. And the objectives of NHRM are reduction in child and maternal mortality, universal access to public services for food and nutrition, sanitation and hygiene, and universal access to public healthcare services, with emphasis on services addressing women's and children's health, and universal immunization, and also promotion of healthy lifestyle. The Government of India has also introduced a program which is called the Janani Suraksha Yojana, JSY. It is a safe motherhood intervention program under the National Health Mission. It was launched in the year 2005. It was implemented with the objective of reducing maternal and neonatal mortality by promoting institutional delivery among poor pregnant women. What I would like to mention here is, Dr. Nisha, when we are talking about delivery, especially in the rural areas, in places where women are, not having proper economic, they don't have that resource, they are poor economically, they usually do not go for institutional delivery. They do not go for qualified medical practitioners to deliver their baby. So what happens is, when an unqualified medical practitioner delivers a woman's baby, then there might be a lot of complication in delivering the baby, wherein the baby may not survive or the women may not survive. So it is very important that women should go for what is called institutional delivery, wherein, they should deliver the baby in clinics, they should deliver their babies in hospitals, where if any complication arises, then they can be immediately taken care of. Then we have what is called Mission Indradhanush. The Mission Indradhanush was launched in the year 2014. The aim was to strengthen and re-energize the program and achieve full immunization coverage for all children and pregnant women at a rapid pace. The goal was also to cover pregnant women and administer them tetanus vaccine and distribute IFA tablets to them. When we are talking about immunization, when we are talking about vaccine, Mission Indradhanush has gone a long way in providing immunization for children, in providing immunization for pregnant women, because when we are talking about immunization, when we are talking about vaccine, if you have to go to a private clinic or a private hospital, it may be very expensive. You will not be able to afford the vaccine or the the various yearly or monthly vaccines which a pregnant woman or a child needs. So Mission Indradhanush has gone a long way in providing full immunization coverage for all children and pregnant women at a rapid pace. So, like I said, these are the various programs which has been launched by the government of India to take care of a women's status.
Thank you, Dr. Grace, for being with us, and thank you for elaborating upon such an important issue of healthcare of women. You discussed about what women's health is. What are the different indicators which help us to measure women's health and which help us to find out what is the status of women's health in our society? And you also discussed about what are the different problems, what are the different issues and challenges that women face in terms of health, and various measures that can be taken in order to improve the status of women's health. And finally, Dr. Grace, you elaborated upon some of the important government policies, important government programs which are available for women healthcare. Thank you, Dr. Grace, for being with us, and I hope that all our students were benefited from today's lecture. Thank you.
Namaskar, thank you.
I welcome Dr. Sudhansh Sharma from IGNOU SOCIS as an expert for this session